All right, hello and welcome back to Dr. Moses YouTube channel. And so on today's episode, we want to talk about certain group of medications that can cause high blood sugar. Are you experiencing high blood sugar? And all of a sudden you started taking certain medication and you went to your doctor's office and he said, oh, now you have diabetes and you don't know what is going on. Well, I want you to look into your medicine box today. So let's dive into it and see the group of medications that can cause high blood sugar. The first group of medication is antibiotics. There's a group of antibiotics called the fluoroquinolones. Now, in this group contains gatifloxacin and levofloxacin. These are medications that are prescribed for certain infections in the body, but the studies have been shown, it's a small one Canadian studies that was done, was shown that people who were taking especially gatifloxacin had a tendency to develop high blood pressure, high blood sugar. And so it's very important that if you're taking these medications and all of a sudden your blood sugar is high, is because of these antibiotics. The second group of medication is the beta blockers. Beta blockers is very common. It's used in treating conditions like high blood pressure, or people who have fast heart rate, or people who have just heart disease. And there are a certain group of beta blockers that has been proven to cause high blood sugar and even to cause a new onset of diabetes. And these are propranolol, metoprolol, and atenolol. In fact, atenolol has been shown that if you take it for up to about 9 weeks of therapy on atenolol, and you do have abdominal obesity, then we have a very big belly, abdominal obesity, the tendency of you developing a new diabetes is very high. Okay, but there are other groups of beta blockers that if you have to be on beta blocker, these do not cause high blood sugar. And these are carvedilol and also nebivolol. Carvedilol and nebivolol do not cause high blood sugar. So if you have to be on a beta blocker, these are some of the things that you need to discuss with your doctor. The third group of medication that can cause high blood sugar is the thiazide diuretics. These are chlorthalidone, hydrochlorothiazide. In fact, during the one of the sessions when hypertension was discussed, actually hydrochlorothiazide was listed as the number one medication for treating blood pressure. However, there has been a lot of studies done showing that these can cause new onset of diabetes and also can cause elevation of blood pressure. The exact mechanism is unknown. There have been a lot of postulates why this medication will cause high blood sugar. So if you are on these diuretics and you have diabetes, it will mess up with your blood sugar. So talk to your doctor so they can make a change to treat your blood pressure. Then the fourth medication that can cause high blood sugar is the second generation antipsychotics. These are olanzapine and clozapine. Olanzapine and clozapine are used in treating schizophrenia, and people who have been on this medication have a tendency to develop type 2 diabetes at a point in their life. And so if you're on this medication, you want to talk to your doctor and see if they can use other generation of antipsychotics to control your symptoms. In fact, there's a 7 times higher chances of you developing diabetes or high blood sugar if you're taking this class of medication. The fifth class of medication that can cause high blood sugar is corticosteroids. You and I know corticosteroids can cause high blood sugars. And so if you're on steroids, prednisone, if you're taking it for a short term, it's okay. But if you're on it for a long term, you can develop what we call steroid-induced hyperglycemia or steroid-induced diabetes. So this is very important to know. And the sixth group of medication that have been shown to cause high blood sugar, these are medications that are taken by people who have had transplants, and they actually help you so that they prevent the rejection of the transplanted organ. And these are tacrolimus and cyclosporins, and the other one is sirolimus. These medications, if you're on them, they can cause high blood sugar or they can cause diabetes when you're taking them in the long term. Now, the last but not the least is what we call the protease inhibitors, the protease inhibitors. These are medication, they are essential component of the anti-retroviral treatment. People who have HIV and AIDS who are taking these medications, they can develop high blood sugar and they can also develop diabetes. So if you're taking any of this group of medications, you need to talk to your doctor because there are other ones that they can give you that can prevent you from developing a new onset type 2 diabetes. Now, if this information has been very helpful to you, I want you to subscribe to my channel and share this information with your friends who are on this medication. Maybe you can prevent somebody from getting a new onset diabetes. And also like my channel and also leave us a comment. Until then, I say you stay well.